on the subject of like dealing with tricky neck stuff, I don't know if either of you have encountered yet working with people with very tricky, sensitive necks. I had actually a very crazy case that happened yesterday, which I'll fill you in on, which even expands on this a little further. But the scenario is like encountering clients that come in, and it seems almost no matter what you do, that their neck will be reactive, right? Despite best intentions, even going gently, like some people, I'm one of those people, unfortunately, that their necks don't necessarily respond well to massage. We'll call it textbook massage, which is the stuff we learned in school, but may respond to some other manual therapies that aren't so much covered or considered to be part of massage, which are, you can do it, you have my permission to do it. But we're often boxed into kind of like, okay, somebody has, neck issue, they come in, you have their neck, you do this, you do that, you do the stretches, you move them around. It might even feel good to them while you're doing it, but afterwards they're left with neck soreness, or say they get headaches or anything. Has anybody encountered anybody like that?
My neck is sensitive like that, actually. Lately, like past couple of months, it's just been like everything just bothers it. So I'm like the patient right now with that, the client.
Okay. And in the past, if you've gotten, not sure if you've gotten treated with massage, has it responded like almost like there's a kickback, like it almost can feel worse after?
Yeah, in the past it felt good, but now, like as I gotten older, it's like, okay, it starts to feel a bit worse before it feels better.
Okay. And is a massage treatment, so I'm assuming, let's say somebody's not being aggressive or going just deep for the sake of going deep, because this can happen even with like gentle approaches. Has that been the case also with you? Okay.
Yeah.
Okay. And Ambrose, any specific experience with this? Just checking in.
Yeah, can you hear me?
Yes, I can.
Yeah, I feel like neck is one of the things that I most often, when I check in a day or two later, people are like, yeah, it's either worse or it's still going. And it feels really tricky.
Right. And I know for a fact, I've seen you work also, and you have, like, you tune into like gentleness when you need to. So it's not an issue with aggression, right? I don't feel, especially that's not the case with you, and been there on that end also. It's really, really, it can get really, really tricky. And a lot of the times, and I'm in this position talking about this because I've done all the wrong stuff before, and I've learned this the hard way. And it's been finally found ways that it's like, okay, how do we approach this with people that have what I like to call diva necks? I have a diva neck, right? And a lot of people, it can also, one thing we also want to prevent when that happens is a lot of people get really worried. They're like, what's wrong with me, right? Could there be an actual issue? Yes. But if you've done your intake and they're like, I've had a neurologist look at it, nobody finds anything wrong. Maybe a lot of times they do have a history of herniated disc, right? Or some kind of injury. We're going to put that on the thing as flags to look out for. Okay. So with setting this up, and not to say that you don't already do this, but even as you might have heard me say this in the past, but the intake process is the golden moment to find this out. Okay, this is before they even get on the table. One thing is, if they've been having this experience with their necks, right? So I'm going to give you the game plan, okay? And I don't know how much time you have with people wherever you're working. If you're working privately, you have a little bit more leeway. Luckily, I've structured my life, and even where the clinic where I work a couple of days a week, I have a good half hour in between people, so I don't have to rush, right? That's time on me that I usually take about working with somebody for the first time, 15 minutes before they get on the table, as long as they're not in a rush. Does that make sense? So you want to check in. Ask them, hey, are you in a rush or anything like that, to make sure they don't have to be off the table at an hour sharp. Because if you don't do that and we start asking these questions, people tend to get anxious, right? Like hop to it, sister, you know, like, so the spiel I do in the beginning, and this again, it depends on your work context, okay? Some people don't have that luxury of time. Like some people have 5 minutes of an intake and it's like, get on the table. I think that's part of the problem when dealing with people that have a problem, that are coming in for more than relaxation. So I'll give the approach that we can try with 2 different scenarios. So the first I'm going to go into is like, let's say we have 10, 15 minutes for an intake. You're working with somebody for the first time. We want to understand what their prior experience has been, because I know, Latoya, like now that you've been having this issue, whenever you go in or decide to get a massage, you're like, you're already concerned about how your neck's going to be feeling, right? So we want somebody to disclose this. So invite, because people won't, and not because they don't want to, because these are questions literally nobody has ever asked them before, including many other healthcare providers. Okay. So let's assume they're coming in for neck pain, headache pain. They landed to you for a reason. One very true scenario is a lot of people after a bad experience with massage, they're not going to go back. That's unfortunate, right? And this isn't even anything against the practitioner, because I've been that practitioner on the other end, because this can happen despite best intentions. Make sense? So we have that in mind. They're already anxious. So we're going to assume they're not in a rush for their massage. And most people are happy to let them know. So the spiel I give them is, hey, you're in a rush? Cool. All right. So I want to do the best job I can for you, right? So I'm going to ask questions and assure them at that moment, if I ask questions for 5, 10 minutes or so, could be up to 15 minutes, it's not going to cut into your table time. I'll make it up on the other end, if you have that wiggle room on the other end. If not, that's not an offer we can make, because people want their massage. Make sense? Most people, all things being fair, and that you have like at least that half hour in between bookings, you have some time to play with. So a few of the questions that we want to check, because we want their neck at ease in our hands before we even start the massage. Because I've learned this the hard way. One thing that seems gentle to somebody, this person's a whole other ball game. And if you move their head, it's already, they're on alert. We lost the game, okay? Or you have to work twice as hard to get them to relax again. So things, of course, we want to ask obvious things like, have you had any history of injury or anything like that? Some people might report, yes, I've had a herniated disc. Let me get this here. A herniated disc, I'll just write HNP for herniated nucleus pulposus. That's a very common thing that can actually sensitize somebody's tissues. The next one is any history of injury or anything like that. Okay, like whiplash, right? Whiplash, sports. This includes, oddly, like orthodontal surgeries. Okay, like history of braces that can make stuff sensitive in people. Okay, seems left field, but just put it on a shelf as a possibility that can make somebody's neck sensitive. Okay, so I'm just gonna write okay, not limited to this, but for example. And I'm going to pull up, do a quick screen share, which I'm going to have to edit this for copyright reasons. But these are little things that people don't always consider, which make the plot thicken. Can you all see my screen? Okay, I'm going to pull up an image here. Here is a groovy little image, trigeminal nerve. Where is it? Boom. So right here, the trigeminal nerve, okay, this is the one that innervates the face, okay? These also feed into the teeth, Okay. Now, there is this section called the trigeminal cervical convergence or complex, where the trigeminal nerve, right, somewhere here in the brainstem, it sends a few tentacles down into the cervical spine. So that's trigeminal nerve is in the brainstem, cervical spine are the spinal nerves. This is hectic, right? These little guys that start to stick out here. So the brainstem sitting up in here in the brain sends a few tentacles down, and it innervates usually C1, C2, and C3, which radiate down through the neck here and sometimes down into the arms. Okay? They're separate innervations, but they kind of tangle like an interstate highway, and there can be crosstalk within those systems. Okay? That can heighten sensitivity. Right? This goes also for whiplash injury. If this area gets whipped around, it becomes very sensitive. And this I talk about more in the video. So if you don't have it, I'll just show you. It's another 20 minutes that shows you some alternate techniques. Okay, but that can make those wires in there. It's like a trip wire, like a little hot wire that anything that messes with it, it's going to go zap. Okay, it's going to get overstimulated very easy, and this is where we get like this kickback, unintended consequence, despite best intentions and all of the things being done as conservatively as possible. So now we have to find, for lack of a better word, okay, I'm going to stop presenting here, the sort of love language for this particular person's nervous system that's gonna have these tissues feel safe, like they don't have to be on guard, not overstimulate them. So you're not doing anything wrong, right? When you're doing this stuff, what's happening is because of any number of issues, there's like some congenital deformities that can happen in the spine. Like if you move the head too much, the vertebrae get sensitive. They start annoying these things. And these things are so reactive. It's like some people can't eat spicy food because it'll cause their stomach to get upset, right? Even a little spice. Even if you put pepper on something, which is a normal, people are like, oh, it upsets my stomach, right? Nothing, that's how these little nerves get, right? So we have to find a way to make them happy, to make the food taste good without upsetting their tummy. Does this make sense? Same idea. Okay. So after we get an idea, of course, like as clear a picture as possible, and let them know anything that might seem unrelated, even if it doesn't make sense, tell me. You have no idea when something can relate in weird ways because the nervous system is a wacky, wonderful land. Okay. Next, let them, one of the most important questions I ask, not just for this, but for every case almost, which has saved me and the person so much headache, is what have you tried before? What was helpful and what wasn't helpful? Okay. If you don't ask that, chances are they're not going to tell you. I had a woman say, when I get massage on my neck, it feels good, but I always end up with a headache the next day. Ah, okay. Then I want to know, what kind of massages are you getting, right? That you think feel good, but that still cause this reaction. Because that's what I don't want to do already off the bat. I want to make them feel good, but I don't want to do the things that could be causing it. Make sense so far? So the next thing we want to ask, I'll just put this in a different color second. Right? What helps? What doesn't? Here's a big one I find. Or what have you been doing? So what have you tried? People are like, oh, I stretch my neck out a lot. That's the only information they give you. Now, what I have to ask is, you have to tease it out of them. Is it helpful? Is it helpful? Some people be like, not really, actually. Okay. And here's the thing, if something is helpful, it would have helped. More of something that wasn't helpful isn't going to help it. Does that make, okay. So if they're stretching their neck, remember these nerves that are coming out of here, and I use this as an example, stretching might not, if they're like, it feels better after I stretch it, cool. Maybe I want to do a little bit more long holds like that. Like not all the way. A lot of people do those neck stretches where they take it in. If you do that to me, bad news bears. Okay. So what I explained to them is maybe don't stretch it for a bit. Now, if they're always doing this and it's not helping, at most what it could be doing, because if you look up on the internet, neck pain, YouTube is going to be like, stretch your neck. Here's stretches. Do this. Hold it for 30 seconds. I think that's some of the worst advice I've ever encountered. And if you do that and it works, cool. But for most people, it doesn't. And the thing is, when they do it, they just tend to do it more because it feels like something when you do it, but it's not the thing that's helping it. It's like a distraction and it's actually irritating it. Make sense? And a lot of times, most often the case, I would say, unless there's some other disease process at play, these nerves get overstimulated very easily. Not understimulated. They're already like, wait and see what's going on. And then a little bit more drives it over the edge. And that gets processed as discomfort and pain because it just had way too much thrown at it. Okay. Stretching it here turns the nerve on in a way. So you're going to eat, stretching it there, holding it. It's like stimulation, 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 when what the neck needs is it slackened and turned off. Does that make sense? And a lot of people don't think of it that way. They haven't had it explained to them that way because that's not what's on the internet. So letting, and I love having rubber bands and with hair. I always have a hair tie around. This is the one thing I'm like, simple question to ask. When I stretch something, does it get looser or tighter?
Tighter.
Right? And then when they see that, they're like, that makes sense. Now I'm like, if it's helping you, do it. But it's not. That's why they're here. See, that's why you came in. So what I say is, are you okay if we try something else? Right? Because we have a little bit, and I noticed, oddly, this is the strategy of getting people to trust you, trust your hands, try a new approach, right? But considering they've had bad approaches, why is this one going to be different? We have to do something different. And they don't know us. They have no reason to trust us. So how we phrase the questions to move the process along, let's say if you have 5-10 minutes or whatever, I'd like to take time, if I have time, is what's going to frame their head to be open and receptive to how we go about these next steps that we're going to talk about. Okay? Because I let them know, okay, you're like, we can't do the same things with you because your nervous system is different, right? There's nothing wrong with you. It's just sensitive in there. We can then associate what they told us in the intake, right? What are the possible reasons it could be sensitive? Okay, you hurt your neck a while ago. So it could be that those nerves now in there, the nervous system's doing its job, wants to protect you. They're always going to be like, so any little movement that puts it on alert, we don't want to do that. So that's why when I work with you, I need your feedback and we're going to go slowly. How does that sound? You don't say, always, I'm asking the question. They're usually going to say, yeah, but bringing the question back to them. How does that sound? Does that sound good to you? And having them make the choice is huge. Do you have any other ideas? Anything else helps you? I say, oh, heat helps. Cool. Maybe we'll do distally and let that warm up first because it likes heat, right? That's the next one. We already knows what helps, what doesn't, and let them know I'm not going to do more of that. I can go in. I know you like how it feels while it's happening, but the results are telling us We might need to try something different. Are you open to try something else? We need that buy-in from them. Because if they, right, setting up the expectation is the most critical part before we even get to the session. Is that they're going to know that this is going to go a little different. You need their feedback. You have to encourage it because they're not used to having that. They're used to laying there, somebody doing stuff usually, or they're going in other settings. Again, not everybody, but most of the time, like another type of healthcare provider, physician, like just giving them commands and not saying, how's that? Those little things have a neurological effect. It's not just like being nice. And it's, yes, we want to be nice, but it's not just about that. It's having these not be on guard and having these that even if we do something that at first seems tentative, they trust that we're listening and we're going to back off right away and that we're not hurting them. Okay, that we're not going to do that. Because the video that's attached, it shows one way of doing it and guaranteed that way for somebody else is not going to work. So I want to set up the foundation so you have a good basis for which to be and communicate them, and almost like let your client teach you, right, how to work. They might not even know yet because you haven't found that, right? So I've had to work with people this way. That's like, oh, that's how I learned most of my techniques, is because my client guided me through what felt good and nice. And I felt their tissues just go like this in my hand. And the second I felt them do this or hold their breath, I'm paying attention, right? So you're noticing little things. You get really good at like noticing the nonverbals and checking in with them. And that goes such a long way, right? Less is more. So it doesn't have to look fancy. What works for them and what I've done with people, you'll see in the videos. Here's Hector here. We'll use Hector. I don't have a human. Is sometimes it's just me letting their head in that position because that's what feels nice. And that's what I do for like 2-3 minutes. That's it. Is that everything? No. Sometimes I'll tell them, here's my hand, and you see in the video, and then I have them do the movement, right? And I'll say, I don't want to put you to work, but you know best where to find the spots. So I'm going to hold my hand there and you move your head where it feels nice. So we're going to find the spot that's kind of sore and just nice and soft. If you feel them pushing in too hard, direct them to back off, right? And always remind them it's not supposed to hurt. Nothing should hurt or feel intense. Should only feel like we're making space. Because they're usually having people do is like, you know, push in. And people are surprised. They're like, oh, so I'm not supposed to feel it? And I'm like, kind of, yeah. That's more like it, right? Because we don't want to, because I'll do it on myself here. I'm pushing in here. It feels like something, and that's the thing, but it feels kind of, I feel it radiating up into my neck right now. Okay, I feel it radiating up into my neck. So what I might do, and you have to try different things for different people, right? One of my first go-tos is I give it a hug instead. That feels so nice. My neck likes that. But if I'm not used to this and I'm like, oh, wait, no, but I don't feel it. It's like, well, that's what we want ultimately, is not to feel it. Right? So that I'm there. Now, holding here, you might need to move with arm positions, right? Bringing the arm up a little bit while they're on the table. So if they're like, that still feels intense, and then I might move their head a little bit. Say what we want to find is we want to find where the signal's turned off. Does that make sense so far?
Yeah, you're basically saying get them in a position where their neck is not going and they're comfortable.
Bingo.
Okay, got it.
Like some people, their neck, I believe, I still like had one yesterday. He wants to feel he wants the sauce, and I can do that. Boom. And that's what's benefit. He likes that feeling of intensity, does not make him sore the next day. He likes just likes it a little spicy, but not everybody's like that. So you have to be adaptable. And if somebody's saying, yeah, get in there, or if somebody who has had lots of deep tissue massage knows that's what works for them, that's what I'm going to do. I'm not going to be like, let me hold for 3 minutes. That's going to be an annoying experience for them. But when you find somebody who's concerned that they're going to get headaches and things like that, setting it up and letting them know, hey, the reason why I'm going to go slow. So they don't, this becomes an educational process. And then I let them know, you explain this to any therapist you go to in the future, right? Any therapist will be happy to learn from you because they don't, they're not sure. Say, hey, don't do this to my neck. My neck likes this. Like some, they might call myofascial stuff. Here, like the suboccipital stuff, digging in. Some people love that. Other people, not nice, right? So another thing that you can do, targeted with people that don't have hair, but here, moving and I'll show you in the D&M book. Added stuff here. Where is, okay. There's several techniques for this, but kind of like this area where all these cutaneous nerves are. Okay. I won't show the ones in the textbook because they're already in the textbook. Other things that I found that can be really helpful that you have to fiddle with. So all these little deep muscles in there, and they're fed by these, right, deep nerves like C1, C2, deep in there. And there's a lot of them. There's a lot of them in there. And it's kind of rolling dice to find which ones have their little talons gripping in there. An easy thing is when you find, so I always let people know, I'm looking for, my intention's not to hurt it, but I want to find where it feels stuck in you, or you tell them this, or you put your finger on it. You know where it is. I don't want to go digging in something because I know you get irritated. They do it. Or you can put my hand on it and they'll say it's right there. Okay, these are okay things to do now that you have that buy-in. Say, I need your feedback. We're going to go about this slowly because I want to find what is helpful for you and works for you. Right? Say you pointed out, not that you don't know, like I could find I can dig in there, but just by virtue of poking around, being like, is it that? Is it that? Is it that? We want to minimize that frustrating experience. Say, you know where it is. Put my hand on it. I don't want to dig. I don't want to irritate it. Or you might try a few, and if it's, sometime you nail it, but because it's a very exact little spot. From there, doing things like here, and I let them, different hair types are different, get permission, of course, to touch people's hair. Is this okay? And you want to make sure you're not pulling it just by the grip. But these occipital muscles just also, see how when I bring the hair up, it brings the scalp up here or to the side. You can take a handful, or it can be very specific, like little things like that. Make sense? And there's, let them know, it's like a Rubik's Cube. You want to find the right little combination. And when you get there, you just hold. Right? So this we've learned from class. It's standard hold, give it at least 90 seconds. And I tell them, we're going to give it, I just say it's well studied. You don't have to go into the whole thing. And if you want to give them the stuff, it's all on the website. We're looking for what's making everything so reactive, right? So we want that nerve to calm down. If I do this, it'll feel good maybe for now, but this is why you've been getting kickback pain, is because we're giving it too much stimulation. So we want to shut it off.
Tania, can I ask a question? When you're cueing someone on the table, what kind of words are you using to like let them know what to be looking for to communicate back to you?
I tell them it should feel like it calms, and so the different things. And that's a great question because different words land for different people. And every so often there's somebody who it doesn't, no word makes sense to, right? So, but the common ones that usually I'd say, let me know when it feels like it gets quieter, it gets less ouchy, or it gets less spicy, or it's calmed down, or it's settled, or it feels uneventful. Like it'll be a little bit, you'll find it enough for them to be aware of it. We just want an awareness of when it feels like I move and now you don't feel my finger, while not changing the finger pressure. So this does take, it's deceptively simple because I can cheat. I can cheat real easy. I can So here's my finger, for example. I can do that, and it'll make it feel like it's relieving. But here's where you can't cheat, because when they get up, they'll know if it feels better or not, right? I can also make anything feel spicier than it should. And this is the challenge. Like, you want to use consistent, which takes practice, play with it. You want to use consistent pressure with somebody, because I want to make sure that I'm not pushing hard for the sake of pushing hard, where other people might require a little bit more stimulus to find it. You want to keep that consistent to all other parts. And some might feel like, oh yeah, that feels a little sore, but it feels nice to press on. But the ones that feel like, oh yeah, that's like, people usually know that's the spot that I know some tomfoolery is always happening in. And we all have those spots. Like, yes, mine is here. Okay, mine is here. What it likes is this. And when I bring my head to the side, opposite of a stretch. And I hang out like that. So that was the next plan that we were talking about. Is that making sense so far? You have to find different things out.
Yeah.
Try it. Now, let's say something like squeezing skin this way is too much. It can be subtle. Like, and this is where we get into some DNM stuff, like moving the skin this way, twisting it. It might be coming from the back of the neck, right? To head position. So when all else fails, if I can't move their head in a position, I say, you move your head in a position where it feels most comfortable, right? Pick it up. And you'll see in the video how I guide some of those hand movements. Those are some of the passive approaches. Active approaches is then having them move slowly, right? I'll cue them slowly, because then they might just start turning, say, no, slow, like feel it, move it in ways where you want to start feeling it untangle. And I let them know, if it feels like it's getting stuck, let me know, because then we have to try something new, right? Sometimes it feels like it's moving along, and then we have to find, oh, the wire's coming from somewhere else. Maybe you have to move your arm. That better? So this is a real-time teamwork effort. The video presents one of a few different strategies, and then take this information, and then you will have to like come up with your own strategies, right? It might be, oh, another thing I like, is there anything you don't like done, right? Some people be like, don't touch my hair. Maybe they just got their hair done. Maybe they just don't like their head touched. And if you do, say, okay, got it. There might be parts where is it okay if I move the head around here? So it's always like, like a permission-based thing. So their nervous system isn't on guard at all, because that little bit can drive it over the edge. It's bizarre. So when we go into giving them self-care strategies, all those things in mind. So what you're actually doing on the table, so you're like, oh, this works for them. You're just going to translate that for them to take home. Okay. Oh, their neck really let go and I had it like this. Oh, maybe their neck lets go like this. Some people might have to put in an extension. My neck does not like extension. But a lot of people, this is the aggravating one. Excuse me. Make sense?
Mm-hmm.
So what you're doing is you're just taking that and let them know. So for the next few days, have them try it for like 3 days to a week. Keep up with this. So if we find like this works there on the table, you move it this way. Say you're going to do this, the exact same thing, and you're just going to do that. If they're laying down at night, great time to have somebody do it, because they're already in bed. Let's say their head likes to be in flexion. Put your head up high on pillows. They don't have to keep it like that. It's just for 3 minutes to offload the tension that's collected throughout the day. Make sense? Or if you find out, let's say, when does your neck hurt more? When I wake up in the morning. Oh, maybe they're sleeping weird. Do this to your head, because you know it's going to be a little jacked up in the morning, and then you just want to untangle that. Right? Realistically, that might continue to happen, because we don't know how people are sleeping. It's not realistic maybe they find God's golden pillow of that eases everything one day, but some people just get cranky necks, and you like, oh, that consistently happens in the morning. Do this in the morning. So I'll show you a few quick ones that So some people's neck might just benefit from a little height. Some people's might benefit from a lot height. Turn it to the side and tell them, lay like that for 3 minutes and give this the hug, or move the skin that way, or bring your arm this way on top of another pillow. Does that make sense? And let your neck, you already know it likes to be there, right? For some people that their neck likes to be in hyperextension, things like rolling up a towel, tell them fall asleep like that. Your head doesn't have to stay that way. Like, I'm not telling them to sleep on a high up pillow, but at least for those 2-3 minutes, unwind. Okay. And noting any, like, or just do that thing with your hair that, lets this go. Boom. Hold it there while your head's like that. 2-3 minutes. Gotcha. Hold on a minute. Okay, bye, Ambrose. I'll finish recording it, and you'll see the rest. I'll finish up with LaToya.
Okay, thank you so much.
Have a great session. I hope that was helpful.
It really was. Yeah, it always is. Thank you. Thank you.
Bye now.
Bye.
For people whose neck like extension, let's say at the office, is taking the hands almost like clasping them like this. Same idea. Let me put my hair up so it's visible. Same idea, almost like, when you're chilling like that. So here, and really like almost push the head into so they can move the hair up or down, or more so hugging here, especially if their neck skin like this hold, hugging here and just letting the head like relax. And see how my elbows are coming forward. This actually feels good in extension, and a few breaths. And it's almost like the occiput, like usually somebody's hand size for their neck, they're not, like, the hand shouldn't be stiff. It should just be soft. And it's almost like the head is going to, like, if I was making it, it would squish my hands here. But when I have them interlaced, it makes a little bit more space. If they want less room, they just can remove fingers and it'll go back and back. Does that make sense?
Got it.
Any questions or anything about that, or?
So like, if it's a trigger point, would that be the same? Like, would you handle it the same? Like, say it was something point.
Got it.
Because that can make it a little funky, like, because if it's triggering, it could be coming from somewhere. You know what I'm saying? Like, how would you deal with that if you found like it was a trigger point, and like if someone, like, I tend to do this myself, so I like to use myself as an example because usually somebody else is doing it, so right. I know how it feels in me, so I have a little bit of idea. So, and people who do this, I catch myself doing this all the time.
Good example. Okay. So like something like action. So let's play with you right now. Like, even though I'm not with you, we'll see what we can do across the screen. Okay. So if you could point to where that trigger point is, like, where do you feel the meatball, or is it like general tension?
It's maybe like in a trap area. It'll feel like it's like in a trap, like somewhere around here, right?
Okay, middle trap. So you're feeling it right now?
Yeah.
Are you aware of it?
Then,
okay. That is your right or left shoulder? I can't tell.
Right shoulder. Okay.
So I'm going to mirror you this way. Okay, so it looks like this. So I'll find, I have a little one there too. Okay, cool. So with your arm in this position, I want you to slowly actually bring it up and then bring it back, and find that. So one direction might feel a little spicier, and one might help it feel looser. And even this includes like bringing your arm down, like if you're shooting it down your leg, like making your arm really long this way. So you can pull, like, make your arm long that way. Any of those making a difference in it?
Yeah, going up.
Going up feels spicier, or okay. So if that one feels spicier, I want you to shoot it all the way down, like lengthen your arm. Does that one feel better?
Yes.
So now we found the turn off switch. So the way that I would handle something like that, I would ask somebody questions just like that. So let's say I have them on the table, right? Whether I almost might want to, depending on how reactive it is, let's say they're supine, right? And sometimes usually somebody with like very sensitive stuff, I'll have them supine so their brain's not, because they don't know they can see what I'm doing. And even I move like kind of like when you can work on here when somebody's laying on the table.
Mm-hmm.
Right. So somebody's laying, I just want to, so somebody's laying on the table. Let's say you are and you would have their hand. So you found the spot.
Mm-hmm.
You are checking, sometimes moving the arm up this way, which what I will do is like slide the whole thing up that would make it spicier on you. But then I would say, usually if it's one thing makes it spicier, I always try the opposite first. You know,
Okay.
Okay, for some people, like that makes it spicy, then I'll try it this way. Even though this seems counterintuitive, that can, but it's different in everybody. So then what I'll do is I'll just hold it there till they're aware of it. And then I would stretch your arm just like that and hold it passively. If it's not responding, then on the table, I would have you shoot it down just like you did, right? So the difference, this is covered in the video. Sometimes it'll respond to like the passive movement. Other times, if it's a motor nerve, meaning the one that turns the muscle, that we have to talk to again. And I'll say, just hold it there easy, like not forceful, just gentle, gentle till it softens up. And it will.
Okay.
It will. So just, does that make sense? So you, and
It
I want you to
does.
try it on yourself right now. So we'll both do this because I have a spot too. Okay. So we could, and if somebody can't reach that, like they can get it on a wall or something, that's not. And the thing is, it's going to work whether they're pressing it on or not. So you found it there, and you're comfortable enough to hold it.
Yes.
Okay. So shoot it, and here are other little other little nuances that might. So when shooting it down, little things like this, somebody, whether they have their hand this way or open it this way or turn it back, that can make a difference too. So play around with the one that makes it feel less.
So it's less hand turn.
Is when you turn it. Might be turning it in, turning it out.
Yeah.
Got it? So just hold it there. Look at a clock, like 60 seconds. So don't change the pressure in your hand. Keep that consistent. And then, like, if you reach through your fingers, wiggle your fingers around a little bit, and then how's it doing?
It's doing good. I feel some tingling like in my fingers.
Okay, give that about 30 seconds. See if that tingling passes or not.
Yeah, it's passing. I feel it.
Okay, good.
Yeah.
So the reason I mentioned, because could that be like, we don't want to like aggravate tingling, but it does that because we're being gentle when it works itself out. Sometimes it's like, so I give it like 30 seconds and I just let people know, oh, if it's fading, cool. If it persists, we'll back off a bit and try something else. That doesn't cause, make sense?
Yes, it makes sense. Oh, that's awesome. Wow.
See?
That made a difference. That made a really big difference.
And when you show that to people, like it's, now whether they do it or not is another story, but it's, the camera's not, but it's like, you have to try like this way, lay this way, lay that way. Maybe their head so you have to try different things, and that's where you want to hold it, and that's their button and usually these are things that people can do with themselves.
Nice. Okay.
Cool.
Cool.
Any other questions?
No, that was awesome.
All right. Thank you for coming.
Thank you for having us. I was like, oh snap, I gotta get this. I gotta get it.